you recall last time we were talking about degenerative disc disease, we call it DDD or triple D. A lot of people have degenerative disc disease and they do have the symptoms. However, they don't know what it is, and then they go to their doctor, medical doctor or chiropractor or osteopath, and then they're told that you have degenerative disc disease. All of a sudden they come to us, guess what, doc, I was told I have degenerative disc disease. It's a disease, is it bad? And I have to sit down and explain to them what it is. So briefly I'm going to go over, I'm going to show you a normal disc, and then I'll show you some degenerative disc disease model, and so you can see what the difference is, and also disc herniated model as well, so you get an idea of what's the difference. So we have one that is a normal disc. As you can see, disc height normal, meaning that it is hydrated, it is gelatinous, it has the cushion, it's healthy, so it's your body uses it as a like a shock absorber, and also uses it to separate the two bones away from each other, the vertebrae, and that allows that little hole where the spinal nerve comes out. And so that's what a normal disc is supposed to look like. So let's look at another one. We're going to take a look at a degenerative disc disease. So this is how a disc disease looks like. So as you can see, compared to a model that is normal, you can see the height is lower, it is dehydrated, and because it is dehydrated, it's stiff, it doesn't have the cushion, and it doesn't it doesn't act as operate as a shock absorber. So there is pressure on the bones above and below the vertebrae, so the bone gets thickened and the bone gets bent, so it does affect the bone. That's when you have degenerative osteoarthritis. This is arthritis at the back. But that's how degenerative disc disease kind of look like, so compared to a normal. So it gives you an idea. So once you do that, because of the hole gets smaller, the nerve gets irritated, and so you have what's called stenosis, which means narrowing of the hole where the nerve comes out. Stenosis by itself may not cause problem. However, because there's pressure on the nerve, now the nerve is irritated and the nerve gets inflamed. Once you get the inflamed nerve, then you get this pain and numbness and radiculopathy, shooting pain down the leg, because these are your low back we're talking about. So that's what it looks like. So that's then you have, of course, very briefly, I want to show you. This is somewhat a little more advanced than the other. So this is not so advanced, and this is far more advanced. Just wanted to show you the difference between. So there's more issues with the. Now it starts affecting your bony structures, but either way, there's pressure on the more advanced. You see the pressure on the nerve and the irritation. Now, when you have back pain, so how do you know if the back pain is due to degenerative disc disease as opposed to other, like a disc herniation, or for this matter, facet syndrome? Okay, facet. I think we talked about facets before. Facets we have facets in our low back, okay, in the lumbar area, and also the cervical area. So facets are there basically, as you can see. These are called facets. They're there so you don't throw your back out. So kind of they control the side to side aspect, rotation of your spine, but they glide on top of each other. So if those are worn off, that causes irritation of the nerve, which it's similar to degenerative disc disease symptoms, but then when you have the pain and the type of pain and when you have it, it's different. So let me give you the difference. Facet syndrome, so if there's issue with those facets, with that joints, the gliding joint, so if I have you bend backward, then you have more pain because you're irritating those joints. So we know the source is from the facets. As opposed to if it's degenerative osteoarthritis, Then if you bend forward and sit and bend forward, if it's a disc or degenerative disc disease, then you have. So that gives you a little idea as to what's causing. Also, when you have lack of motion, let's say if you get up in the morning and you have a lot of stiffness and you're like, gosh, I'm pain, my back is hurting. Those are an indication that you do have degenerative disc disease. It is a natural process that occurs as we age. However, or it could be an accident, could be trauma, due to trauma. But the idea is, what we want to talk about is to slow the process, and hopefully we can prevent it from occurring earlier in life. And if you're in your 50s and 60s and you don't have back pain, guess what? You're one of the few people that have this privilege. And some people they have a lot of problems by the time they get in their 50s or 60s. In my case, I'm 63 years old. I don't have any pain anywhere in my back, my neck, my shoulder. It's because I do take care of my body and I make sure that the body is working at its optimum. And so there's no pain. And again, pain is not normal. So that's that.